Welcome to the Floyd Sleep Center. We're going to take a quick tour of our facilities here at the Floyd Medical Sleep Disorder Center. We're going to start with the dictation room. This is a physician dictation room where the doctors come in, do their dictation, review patient information. It's pretty much the doctor's office, so it's where they stay most of the day when they're not seeing patients. When patients arrive here at the Floyd Sleep Center, they check in our waiting area. We get them called back into one of the exam rooms and we see them during the day just like a regular office. When they come in at night, they come in and the night technologist greets them at the door and takes them straight back to their bedroom versus coming into one of the exam rooms and get them prepared for their nighttime sleep study. All of our sleep beds are sleep number beds, so we try to make that comfortable for each individual patient need based on if they like their bed soft, hard, or whatever's more comfortable for them. Also, we give patients downtime when they first get here after we get everything connected up so that they can watch TV or relax. We have the flat screen TVs that we also let the patients use to watch TV prior to going to sleep. And then also, because we like for it to be a hotel type home environment, we have a very large restroom in each patient room. Some patients want to take a shower or bath and get up and go straight to work in the morning before leaving here. So we have a shower or a handicap bathroom as well. If patients need to take a shower, just get ready, whatever they need to do, they all have their individual bathrooms. We have 2 exam rooms where they come in, they sit here and meet with the doctor where the doctor reviews their results with them and talks about different type of treatment options. So again, we have 2 rooms, that way we can kind of move patients around and get them in and out fast. The role of the sleep technologist at night is actually watching the patients while they sleep. A lot of people get nervous and they feel like that we're actually watching the patient sleep, just standing over them. The patients actually are in their bed and the technologist is sitting here right where I'm standing and they're watching 2 monitors. One technologist can watch 2 patients at a time. This is considered an epic. It is 30 seconds of data right here, this one page. One night sleep study usually consists of anywhere from 900 to 1200 pages or epics. What they're watching is the patient's brain waves, heart rate, how they're breathing, see if they stop breathing, their EKG movement, and so what they may have going on there, their eye movements to tell what stage of sleep they're in. So that's the technologist's job at night, to watch that. And of course they intervene if the patient has to go to the bathroom, they get up and help them. If any type of issue, the patient may call out because there's a microphone in the patient room. If they were to need the tech, they just speak out and say, I need to go to the restroom, or whatever type of need they have. The patients come in at about 8:30 at night and the tech connects them up to some wires and so forth that allows them to see what's going on and monitor all of the things that we talked about. And then we ask that the patient go to sleep by 11 o'clock. At that time, the sleep technologist sits in here and we have this break room. And this is exactly what our room is in here. It's a tech room and break room because the technologist cannot get up and leave this area during the night. The restroom is right next door, but they want to be here because we have to monitor these patients all night long to make sure that we're giving them the best care possible and to see exactly what's going on during their sleep. As you can see here, we actually have a patient in the bed that's undergoing a sleep study. You can see the patient on the camera. We do have a mechanism to make the camera larger or smaller just so you can see that part because the tech has to see certain different things on the screen. Here, as I said, we're monitoring the brain waves, the eye movements, the EKG, the leg movements, and that leg movement thing is because we want to see if they have restless legs or periodic limb movements. Their airway, how they're breathing through their nose. We have belts on his chest and abdomen so we can see how he's breathing through his chest. And then also we have his oxygen right here. This right here is showing up as a drop in his oxygen by 4%. So that's the only abnormality we're seeing right now on the screen. And so this is what the tech is actually watching all night long. Here at the Floyd Sleep Center, we also see pediatric patients. The child that we have here today, I'm getting ready to fit for a CPAP mask with the sleep apnea. Most of the time, people are overweight. As you can see, my patient today is not overweight in any shape, form, or fashion. However, with it being hereditary, that is why we've tested him, and with him testing positive, we're going to fit him for the mask. Lots of times with pediatrics, they may have their tonsils taken out, and that gets rid of the sleep apnea issue. However, if they have their tonsils taken out and it doesn't get rid of it, we will fit them with a CPAP mask and machine. So that's what I'm going to do today with my patient. What happens is When you stop breathing in your sleep, your airway closes off, and that's what our main thing we treat is the stop breathing in your sleep. Surprisingly, we do have some children who have obstructive sleep apnea where they stop breathing in their sleep. This right here has a hose connected to it, and it has a machine, and all it does is supply air into your throat, and it keeps that airway open all night long. So if you stop breathing when you sleep, it says, hey, wake up, kicks in. It automatically says, hey, you need to breathe again. It gives you that air to keep that airway open all night. But that's kind of a mask fitting is what I've actually done on the patient here today. Just let him see what it kind of feels like. And of course, like I said, it has the machine that would go to supplying the air. The technologist is actually watching that patient while they're sleeping, and they go up on the pressure depending on how many times they stop breathing and so forth. And we have a policy and mechanism in place for that, because the key to treating this is finding that right mask and pressure, because we want to find the mask that best suits each individual patient, because that's the key to the compliance issue. It's kind of like shoes. I tell every technologist, just because I like a pair of shoes doesn't mean they would like a pair of shoes. We have several different types of masks. I actually have a closet full of various different types of masks that patients can look at, and I encourage them to try different ones, because what looks comfortable may not be comfortable, and what I like as a tech may not be comfortable to a patient this age or an adult patient. So we try to work with each patient individually to achieve the compliance. The role of the sleep technologist is a little different during the daytime. As I said, we run a clinic, which is like a doctor's office, but also we work with patients on finding the right mask, as we talked about, in fitting patients when they have sleep apnea. Here I have different types of masks that we have. So I let the patients look at some of the different masks if they're having problems with the one that they're currently using, to try to find the best fit for them and to see what they like, which is most comfortable. It's a lot like going to the shoe store and looking for what you think may be most comfortable. However, once they do find that mask, we do take them into a room and let them try that mask on, with the actual pressure as well, and see what's most comfortable to each individual patient. That is the key to compliance, and that's something a good sleep technologist knows that we all like to do, because we want to help each patient individually. Here it's rewarding to me for somebody to come in, they're falling asleep while driving, they can't stay awake on their job. That affects their relationships at home when they're tired like that, at work or school. And when they come back and they say, thank you for helping me, or maybe I'm out at a store somewhere and somebody just walks up and says, you have no idea how you helped my wife or my husband, that is rewarding to me in itself. Thank you for taking the time to tour the Floyd Medical Sleep Disorders Center. I think you will find the career of polysomnography rewarding just as I do. I encourage you to get a good night's sleep tonight. We sleep 1/3 of our lives, so the other 2/3 depends on how we sleep and how we will react to our daily situations. Thank you and have a good night.